This morning on BRN, expanding eye care access for the underserved. And joining me now to discuss this, Dr. Paula Ko is with the American Academy of Ophthalmology. Dr. Ko, so great to see you. Thanks for joining us on the program this morning.
Thanks so much for having me.
Yeah, this is great, and I'm so grateful that we could highlight this new pilot program. What is Eye Care America?
Eye Care America is run by the American Academy of Ophthalmology. So far, I think it's helped about 2.2 million people in the United States. And it's basically to help patients who are either underinsured or don't have insurance at all for things like care for glaucoma or just elderly patients that don't have eye care. And when I say eye insurance, I don't mean like things for glasses or contact lenses. I mean for medical eye problems like glaucoma, cataracts, that kind of stuff. And the ophthalmologists that are part of the American Academy of Ophthalmology will volunteer for Eye Care America. And then if you volunteer, you go on to this, I guess the patients can go online at eyecareamerica.org and they can see if they qualify for this program. And then the people who volunteer, they type in the zip code and then they'll find some volunteers that will be willing to see these patients.
Yeah, and again, this is really serving underserved communities. You mentioned some of them, and this is a pilot program, I believe, in the great state of Delaware, but it's a pilot program, which means that it could find its way to other parts of the country. Doctor, let's talk about the importance of going to an ophthalmologist, getting your eyes looked at. Why is that important?
I just want to clarify, Eye Care America is not a pilot program. That's been around for many years and it's very successful. The pilot program we're working with is a new version of Eye Care America, helping screen for diabetic retinopathy. So
Okay.
what I just described has been around for a long time. And so anyone who wants to do that in the entire United States, particularly elderly, it's available now. So sorry. But the what's important about getting an eye exam every year, particularly when you get older, the risk of glaucoma, macular degeneration, cataract gets significantly worse, and diabetic retinopathy because diabetes gets more common as you get older. So all those diseases, sometimes they occur and you don't even know they're occurring. Like for example, glaucoma, you can lose significant amount of vision. Like your vision goes away from the periphery to the center, so you don't realize you're losing peripheral vision until you've lost most all your peripheral vision and you just only have central vision. So just going to get screened for glaucoma is incredibly important because it can prevent vision loss that would be unnecessary otherwise.
And doctor, I guess looking at some of the stats, I mean, there are 37 million people today living in the United States that have diabetes. They're already at risk with the diabetes. Hopefully they're being treated. But as you said, there's an eye condition that can follow, which I would assume leads to blindness and other vision problems.
Yeah. So 37 million people, which is about 11% of the population in the United States. And if you include pre-diabetes, it's about 30% of the population. So that's a lot of people that are either diabetic or pre-diabetic, and it's just getting more prevalent for I think multiple reasons. Number one, as we age, diabetes becomes more common. Number two, Americans are just gaining more weight, and the more overweight we are, the more risk there is of diabetes. And we're not as active, and the least activity you have, if you're not moving around, also increases your risk of diabetes. So it is getting a lot more prevalent, and a lot of patients, even though they know they have it, and even if they have insurance, don't go to the eye doctor. And diagnosing diabetic retinopathy is relatively simple. And when it's early detected, it's easily treatable. But once it gets to the end stages, it's much harder to treat. We can still treat it, and the chance of vision return goes down. So there's multiple reasons to be screened early for diabetic retinopathy.
And doctor, the Academy is partnering with the Henrietta Johnson Medical Center and IANUC. They're bringing technology, artificial intelligence, to help with this diabetic retinopathy.
Yeah, it's really cool. This is the pilot project. So it's the American Academy of Ophthalmology came to us, and I'm the president of the Delaware Academy of Ophthalmology, And I think they came to us because we already have another program with our local hospital, which is actually a very big hospital because for the whole state of Delaware, it's Christiana Care. So we're aware of the premise of getting your eyes screened, not at the eye doctors, but at a primary care office. And it's a lot more efficient. Like I said, even if you have insurance, about 50% of patients with insurance don't even go to the eye doctor if they have diabetes. So you want to screen all those people. So we're used to doing it. We believe in the concept. When I started in practice about 30 years ago, we talked about a concept of getting people screened at the primary care office, but the technology wasn't there. It just wasn't ready for prime time. And now we're getting the technology, the AI, the cameras are really high tech. You can have a front desk person working these cameras and taking pictures of patients that show up to the primary care office, and just get a lot more people screened. So American Academy of Ophthalmology came to us to say, hey, can you help us run this pilot program to make sure it works? Because if it works, we want to, or they want to go across the whole United States to help do that. And we in Delaware, the DAO, we want to go throughout our whole state of Delaware to offer to other people. But anyhow, so they asked us, and then we're partnering with iNUC, which is a company that out of California that uses a very high-tech camera. It's non-mydriatic, which means the patient doesn't have to be dilated. They sit down at the medical doctor's office. So you go in and you say you're going in for a medical appointment, and you sit down with the nurse beforehand, and they take your blood pressure and your pulse and your temperature, and they'll say, oh, you're diabetic. You haven't had an eye exam in the last year. Sit down here. They take a picture. You don't have to dilate you. And within 10 seconds, AI technology will tell them if they have referable diabetic retinopathy, meaning significant enough that it needs to be referred. And that's huge. And this company, iNUC, has been kind enough to actually lend us or loan us this camera for 2 years to make it successful, hopefully.
Yeah.
And then Henrietta Johnson is the FQHC. It's a federally qualified health center that was very, very excited about being part of this project. And we've started it for about 2 months, and they're using the camera a lot. So it really has to work. Like, they have to buy into it, and they really are. So far, so good. I mean, it's something that there's got to be buy-in from the primary care office, because they have to want to use the camera. Because if patients show up and it's kind of a pain and it slows down the process, they're not going to use it. But it's very efficient. The camera is super easy to use, and AI technology within 10 seconds will tell you if you have referable retinopathy. And then that same day, with the Eye Care America, you can type in their zip code, and they'll let you know of an ophthalmologist who has volunteered for this program. And pretty much all of our DAO members have volunteered, and they can get an eye exam for whatever, it's free or low cost. There's certain things to this Eye Care America program, but it's a volunteer program. So
Yeah.
a lot of our members have volunteered for it.
Well, certainly amazing. And, it's another example of where artificial intelligence can help speed up or enhance the process. And look, if you can get more people diagnosed, or at least run through the screening process and find out whether they have or have not, you can move more towards preventative medicine as opposed to reactive medicine. Dr. Ko, we're going to have to leave it there. Great to see you. Thanks so much for joining us. Good luck with the program, and we'll talk to you again very soon on the program.
Thanks for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse. All the news in one place. Details at our website. Until tomorrow, I'm Jeffrey Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.